he would grab the wrong pill box.
I accidentally put eardrops in my dad's eyes. This is Lisa.
And this is Lana.
We are two old friends,
A nurse.
and an actor who are both
Taking care of our parents.
I got some troubles and I don't know what to do. I got some worries and I'll share them all with you. Sometimes we'll talk it out, or maybe scream and shout. It's always easy when I see it through with you, 'cause we are two old friends talking to old friends. Not too old.
This is a podcast about what to expect when you're not expecting it.
2 in the morning, 2 at night is 6 hours apart.
But at some stage, they no longer can.
Two old friends talking to old friends.
This is going to be a great episode that we get to talk about not only all of the aspects that are confusing about medications, especially for the elderly, and at the different stages too, because some of us have parents who are on their own but might need some help, and some of us are actually doling out the stuff to our parents. So that confusing, and then solutions. And the second part we're going to talk about is all different unique ways that I had never heard of how to manage all of the medications that a person might have. I'm going to say this one is me interviewing you this time. I really got to say, because Lana is the nurse, as we know. And it's not that I don't deal with medical and medications and things like that. My dad doesn't have as many, although I can definitely talk about when my mom had her knee operation. Good God, that was awful. But in general, I'm looking to you to answer a lot of questions on how to make everything easier for people. You have a lot of experience, both personal and professional.
Yeah.
So let's get started. We were joking today about, what did you call it? The
badge of honor
that our parents have over not taking too much medication.
Yes. So that is like it's almost like a bragging right that I'm hearing when they will say, well, she's only on 2 meds, or I have now, well, gosh, now I'm on 5.
Yeah.
And so they're embarrassed about that. And they definitely equate that to how well they are doing.
Yes.
If they take no meds, they're extremely healthy. And then if they take 13 meds, they are extremely, and there is obviously there's some correlation, but you can also be very ill and not take any medicine. But it's interesting to me when you hear them talk about, well, I only take 1 med. In fact, I was just at a wedding last night and I was talking to my girlfriend. Her mom's 84. And I said, Joan, what are you thinking about? She's in this big house by herself, and you might want to be proactive and start thinking about some things. And she said, well, Lana, I only take 2 medicines, and it's calcium and, a thyroid. So I do not need to start thinking about things. I only take 2 medicines.
Exactly. My parents used to joke about my grandparents when we would go and visit, and they would have this like Tupperware tub in the center of the table with all of their medications. And it was like such disdain for that. Like, oh, they have to have them out. Well, the reason why you have to have them out is because you got to remember to take them. And if you put them in a cupboard, you don't think about it. So they were there for a reason. And then as time goes on, my parents had, the table full of it. And it was like, damn it. But my mom only was taking the thyroid and very, you're absolutely right. I didn't even notice how proud she was of that until you said that there's this like badge of honor. I'm like, oh my God, that's exactly how my mom is. Definitely her point of pride. Now, when you're dealing with things like your father-in-law has Parkinson's, and that becomes, the illness causes that. It is tough when someone's taking this and it counteracts this, so then you got to take that, and then it counteracts. That's part of the confusing factor. But for somebody who's dealing with a specific issue, they're going to have medicine that is for that issue, and it's going to be a little different than just generic problems from aging. Those are 2 different things. We have a lot of confusing factors when it comes to medications, and I'm so glad we have this episode for people. First and foremost, I think is really interesting, because we've struggled with this too, is brand name versus generic. Tell me a little your thoughts on that confusing bit of info.
Well, each medication, how it kind of goes through the FDA system is it starts off, brand name.
Right.
Okay. And so after a certain amount of time, they can start producing this as a generic medication.
Okay.
So you have the brand name, you have the generic. And a lot of times when people are dealing with physicians, they'll interchange both of the names.
Yeah.
And it can just be extremely confusing.
Mm-hmm.
It just, as a nurse too, I struggle with that and think, okay, now what was the generic? And of course,
the names are like Hagen and Plaxenstein and Plax.
I can't say them. So there's just they are not health literate words. At least 5 syllables. And then, so there's the complexity of just the name, then the generic. So what you can do to help you just keep track of that is write it down when you write your medication list. Write the brand name and then in parentheses, maybe put the generic. But be consistent. The brand name is always going to be the first one and then the generic is in parentheses. And so sometimes the pill bottles will actually have that on there if you get a generic. So always look at that. And then a lot of times I'll just Google it.
Yeah.
And just try to figure out what exactly is the medicine. So it can just, so you're starting off with one foot in the grave. Just the names alone are extremely confusing.
I also think that it's interesting, even just the idea, I know it sounds stupid, but writing all the medications down. Mm-hmm. I think a lot of people don't do that. And that's going to be talking about managing it in our next section too. But we didn't until we went into hospice that we would starting to, they had them all listed down. I'm like, I got to write this all crap down. It was kind of a pain. So even before you're in anything, it would be great to have a form that you keep in a handy place that you can find and make adjustments as needed because things are always changing. So I don't know, write in pencil.
Lisa, no joke. I mean, it is a pencil.
Yeah.
I mean, or on your computer when there's a massive delete button. But so that has to change. Yep, for sure.
So the other factor of having those different medications is not only are the names different, but they're also, the pills look different. So we had that when we were doing that with my dad all of a sudden where's that red pill that I'm trying to find? And he kind of perseverates a little bit on which pill's which. So that can get confusing. I mean, it will be like one's red and one's white. They don't look anything alike for the generic.
As you refill, exactly. As you refill your medications, so there's certain distributors, it's the same generic medication, but they can look extremely different.
Yes.
And we are humans, we're very visual, and that can be extremely confusing, especially when we're working on some of the strategies about how to visually keep track and organize your meds. And then that literally can change colors, shapes.
Yeah.
It definitely is not helping the elderly population, but that's exactly how it has to do with distribution. But it just adds another layer of complexity.
I think to be aware that just because it is the generic brand does not mean it's going to look anything like your brand name.
Right.
Exactly.
Yeah.
And we found the pill bottles.
Yes.
Yeah.
So there's lots of problems with pill bottles. They're trying to get a lot of information on a sticker. That the pill bottle is what? I don't know, 1.5 inches tall. And a lot of the abbreviations they use are from Greek, Latin.
Right.
I mean, what? Yes. Okay. RX is a Latin Egyptian son. I don't remember what it is, but I mean, it's just like RX is pharmacy.
Right.
But there's that whole language barrier. Obviously, for the elderly, the print is extremely small. And
the bottles are different. When we were getting them from a service that was shipping them to us, they were like red, and then when we get them from Myers, they're like these thin ones. And this sounds dumb, and I'm a young person. So if I'm confused by this, I can only imagine how an older person is. Because I had one where I was like, I kept picking up the wrong bottle because that's the bottle that we had for the last time when we had the bladder spasm stuff. This time it was for the, muscle spasms. I saw the word spasm and I'm like, well, one you cut in half and one you don't. And if you just think I don't know if I'd ever told it's been a while since we talked, when I accidentally put eardrops in my dad's eyes.
Oh, yeah.
Yeah.
Yeah. That's very common to do things like that.
I was really relieved with Google when they said it was very common because I had no idea what those two things were. And he's like, this doesn't feel right. And I look and I'm like, oh my God. I was like, I've never been so horrified. I was like rinsing out. I had cloth. I'm like, Dad, I screwed up. I
know. And you're trying to pay attention. And I know.
So now every time I do the eye drops, I say lubricant eye drops. I read it every single time.
And the bottles look the same.
They look identical.
We had that with Jeff's dad. He has 2 creams. Identical. Red bandit. So what I did, I used Sharpies a lot. Took a Sharpie and wrote all back.
That's brilliant.
This is for, and then the other one was for legs. I wrote legs because he had them switched.
Wow.
And I honestly,
how would you know? I know.
And
I don't think I'm stupid.
No, and he's not stupid either. But they looked exactly alike. And again, that visualization, you quick grab.
Yeah.
So we took a Sharpie. We did that. I think the other thing that I did early on, when they were managing their meds pretty well, is so this is the other thing. Okay, so all the meds are in a bin. Well, you look on top of the bin.
Oh, you mean all the pill bottles are all in a bin?
Bottles.
Yes.
So you pick it up and then you read it and it's like, oh, nope, that's not it. Put that down. Nope, no, that's it. So I wrote on the top of the pill bottle, like, this is the time in a black Sharpie. So 9 a.m. And sometimes I would just do a symbol like heart. And I would draw a heart. Or this is pain. Or this is...
That's really brilliant. And I'm not joking. I'm going to go home and do that right now.
Because then you just look at the top and then you can just kind of grab. And then you should double check, of course, but because the tops can get mixed up. Yep. So you make sure if you're going to do that, you put them back on the pill bottle that actually, because they're all, of course, all the same bottle. So that's one thing that we did.
I'll tell you, we did have we had some mailed to us. We knew we were expecting one. And we always write it on. We didn't write it on the top. We always wrote it on like bladder spasm or whatever. And we got 2 pill bottles at the same time, but Mom didn't know that. She only thought it was the one. And we were anticipating one of them more than the other because we were running low. So she grabbed it out and wrote it on, but it wasn't the one that we were anticipating. Yes. And that's how easy it can happen.
It's so easy.
And I said, I put eye drops or eardrops in my dad's eyes. It's so easy.
So right on their eye.
Exactly.
Ear. Yeah.
Exactly. Put a big eye, you know? So, but she did that. And then I happened to follow up and pull the other one out. And all of a sudden I was like, wait, this isn't that one. And she was like, oh my gosh, and I'm not knocking her. I'm saying it is that easy.
It's so easy
to do it.
Yeah.
And so you're right. If you do put it on the lid, make sure the lid is on the right one. It's
tricky. And it's serious stuff. If you don't do this right, multiple hospitalizations, death. These are things that
you said you gave me a statistic that the healthcare, they're humans too. Yeah. So we make mistakes even on the little bit that we do. And the healthcare industry can also make mistakes.
Yes.
A lot.
Yes. So the statistic I found is the reportable.
Yeah.
So whatever that means, 1.5 million medication errors by healthcare professionals. So you have to be an advocate.
For yourself.
You have to be an advocate. So we went to the pharmacist, and luckily I actually had the medications with me. And not that we had an argument, but there was just a discrepancy. And so I got the pills. I opened the bag while I was there. And I said, this isn't right. She said, yes, it is. And I said, no, it's not. It's supposed to increase. And she said, no, this is the order that we got. And then she's like, oh, I grabbed the wrong order. So I had the pill bottle. So it's just very, very confusing. And so you have to know what is right. And so I guess I don't always assume like physicians, nurses, pharmacists, they make mistakes too. And so you can challenge that, and you need to challenge that. If you help me understand. I don't understand. Please listen to me. I don't think this is right. I have a concern. Those are some of the words that you can use because they're human. They're in a hurry, and that those things happen. So
that is really good to know. then you were talking also about the solutions when it comes to refills.
Yeah, so with refills, you really have to be on top of when our medication's running out for your mom or dad. Especially if the medication is what we call a controlled substance. So there's a lot of which we need in our country right now. You can't.
Yeah.
There's a controlled substance. So these are medications for pain, anxiety, where they can be sold on the street. So obviously there's an addiction problem with these medications, but they are appropriate to take for certain ailments. So,
but that's a kind of a bummer because when it does, you only get like 8 at a time or something,
right?
And you have to keep when you said that, like we have several that it's so. I wish you were all at the same time. They all got to be renewed at the same time, but it's not. You have 25 of one, you have 8 of another. Those are taken 2 times a day. This one's only taken, so you're constantly.
We're at the pharmacy every other day.
Exactly.
You know, I mean, it's every other day.
Every time our nurse comes in, she's like, "What do you need?" And we're like, "Okay, we have enough of this until next Tuesday. We have this. We're going to be out on Saturday, so we need to order them right now." We have, it's like I don't know, a merry-go-round of craziness is how it feels sometimes.
It's mayhem. It's medication mayhem.
Medication mayhem. That's exactly what it is.
So especially with those controlled substances, you know, for pain, for anxiety, it takes a while for that to get processed. And the physician has to do it a certain way. And sometimes if the physician office doesn't have this electronic communication, you have to go get the piece of paper and bring that to the pharmacy. So most of them do have that now, but you have to have it called into that pharmacy. You can't switch pharmacies. Half the time, the medications they're out of.
Yep.
You know, so it's like, well, can you just call it over there? Nope, because this is a controlled substance. So then you have to have, so you have to give yourself time for these medications to refill. And there's a lot of medications that you just can't stop taking. Immediately. You know, for seizure medication, depression, you can't just cold turkey those. So I just can't emphasize enough that you need to be on top of refills and you need to give yourself time. Think ahead, weekends. Your mom and dad are going to be gone for 2 weeks. Holidays. Exactly.
And the other thing is, though, some of them, they won't let you do it too early. A couple of my dads, that's the problem, is like we want to do it early so that we don't end up in that situation, but we can't, they're not allowing it. You can't get it yet. And then there's other kinds of, aside from the medications, even just things that are under a prescription, like for my dad's ileostomy with the stoma, getting the bags, getting the wafers that, attach to the skin and stuff. Why they do it this way? Maybe people take bags off. I don't know, but the wafers come in, the ones that stick to the stomach come in 5 per package, but the bags come in 10 per package.
It's like hot dogs.
It's exactly like hot dogs.
So you have 8 buns and then 60
stoma hot dogs. So we just had and right now, I don't know, it's the meanest thing in the world. And then if something's delayed, like the tape wasn't coming in, and then, God forbid, my dad had 5 changes in 3 days. We had so many leaks. And we were going through, and the last time they ordered, they did the wrong size bag. So we only had small bags. So we had 2 of the big bags left. So the nurse comes in, we're going through everything. I'm just coming back from California. So I should have taken a quick peek, but I said, "Do we have enough of the wafers?" My mom's like, "Yeah, we got plenty of the wafers." I said, "Great." Okay, no, we don't. So we're coming up on the weekend when nobody's open to do this. We cannot order them. If we have a leak, I'm telling you, there's nothing, I don't know. So we were freaking out because we only had 2. He had just had 5 leaks in 3 days. If it continued, we're like, okay, we're really screwed right now. So we quick called our nurse to order, but they're not going to get here until Monday or Tuesday. So we realized it was still Friday. I zoomed into the Sparrow, whatever. And I have to tell you, I'm just going to go on a little side rant, but our medical industry is insane. Because that box of 5 wafers was $58. If somebody has that's not even the
set income. Yeah.
Yeah. And that's not even it's a 2-piece. So that's not even the second piece, plus the tape, plus all of the skin prep stuff. I was like, are you kidding me?
Yeah. And let's talk about medication costs. I mean, That
What the hell?
for Medicare, it's called a donut hole. Okay, so I'm going to try to explain this. So I don't know why this is, but let's say you go to the pharmacy and the medication is $600, which is not, I'm not exaggerating.
No, not at all.
The medications are $600. So you have a cap. So it's about, I don't have these numbers right offhand, but let's say it's around $5,000. So you only pay, depending on your coverage and things like that, let's say you pay $20 for the $600 medications or $100, doesn't matter.
Mm-hmm.
But this cap, so $600, $600, $600, so then you get to the $5,000, okay? Well, for some reason, they just don't cover your meds anymore for this hole in the donut. So now you got to pay out of pocket. Okay, and then that is why people don't take their meds because they can't afford $600 a month. And there's some strategies you can work with your physician and things like that. Sometimes you can get help with that. Sometimes you can't. When I was in nursing, I would say, okay, well, they don't have $600. So is there a medication that would work that's a little bit cheaper? No, it's not the Cadillac, but at least it's something, Wow. So it can really, so you have to have strategies. So then you go through this period where you spend a couple grand to get out of this hole, and then it's covered again.
That's unbelievable.
So,
and then the new year starts.
Exactly. So it is a calendar year medication. So a lot of times when you look at medication adherence or how often we'll take their meds, they do really well at the beginning of the year because it's covered. And then towards the end of the year, they're starting to reach that gap.
The gap.
And so then they don't take them. So it's just something to think about. And your parents may be embarrassed by that. Like, hey, we don't have the money for our medicines, but they are very expensive. So yeah,
and they might be embarrassed or even proud.
Yeah.
That's
very
those.
Mm-hmm.
I mean, I think for people our age dealing with that generation, also there's just a hell of a lot of pride and a hell of a lot of, we can do this. We're fine.
And then they start doing things like, okay, I'm just going to take half.
Yeah.
Or every other day, just so they can stretch it out. So they're creative, and trying to get through that.
Because they make do. That is what that generation was, is make do. Okay.
That is right.
So that's a whole topic that we'll stand in front of Congress and tell them that they're crazy at some point in the future. Congress, be prepared. Lisa and Lana are on their way at some point. Another thing you talked about, and I honestly never really gave it a thought, was how you store medications. I don't even think about that. I don't know if we have none. We don't have any that determine a need for anything, but please tell me what I should know.
So a lot of times people store their medications in the bathroom, and it's very humid and damp.
Yeah.
So that is probably the worst place to store your medications.
Oh, perfect.
So if you have to store them in the bathroom, make sure that you put a cap on, because if you're showering and things like that, then that's just not good.
The humidity.
And then the other thing is, a lot of times you've got grandkids running around, you have to put your medications up. A lot of times if you do get pill bottles that are elderly, they're easy to unscrew. Maybe they don't have the dexterity to do the medication safety.
So we're saying not the center of the kitchen table?
Probably not, but that's okay. As you do you, you gotta.
We have no small grandchildren right now, so we're okay.
Yes. But I mean, just things like that. Even pill boxes. Okay, you take all these, all these medication safety things, and then you throw them in a pill box. Well, that's a fun toy. So you really have to think about that, and then temperature. So I remember one of the patients that I worked with. He was on insulin, and he was a builder, and insulin is temperature sensitive.
Okay.
So he's like, I'm doing so good. And my blood sugars, I'm like, okay, well, let's just kind of go through your day here. He's like, well, I go to my site and I put my insulin in my truck and it's 100 degrees. And I'm like, okay.
Ding, 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 ding.
And he didn't even put that together. I'm like, okay, your truck is 100 degrees. So all the protein of that insulin is totally wrecked. And so you're basically giving yourself nothing. I mean, so you have to think about, the temperature of things. Does it have to be refrigerated? All those things can really affect, especially with injections, the effectiveness,
has to be refrigerated.
Of the liquid. So just,
So now when that, is that on the pill bottle? Or is it on the instruction that looks like a book of instructions?
Exactly. And honestly, I can't. I mean, like,
it's a paragraph that
awful.
Actually is block paragraph. It doesn't even have like gaps. It's just like, it's insane. I'm like, I look at that and my whole body goes, I'm not going to read that. Just tell me what I'm
not going to do that.
Yeah.
I don't either.
So we talked about this one time, and I'm not sure if this is part of the second part of the discussion. And if it is, tell me, Lisa, we'll talk about that later. But talking to a pharmacist, because they do have more knowledge about medications.
Absolutely.
So is that something that, in my opinion, just when you get a new medication, not one that you've already done this for years, you know the rules, but a new medication, is there anything I should know?
Absolutely.
Does this need to be stored in any temperature, in any place? And I think people always think they have to talk to the doctor, but the pharmacist know more about medications than a doctor.
And so pharmacists are totally underutilized. And so I agree with that. There's definitely a resource that you can use.
Okay. And even to the point of maybe, like I said, well, you've taken these for a long time, so you already know, but maybe you walk in and you say, can I take a moment to go through my 10 medications and tell me anything I might not have known this whole time that I should be knowing? So again,
we're going to talk about that.
Yeah, we'll talk about that.
Well, let's talk about it now. So most pharmacies, you can't just walk in and say, hey, can you spend, so you make an appointment. It's called a medication therapy management appointment.
Okay. And medication therapy management. That is really good to know. Okay.
And you schedule your time with the pharmacist. I'm 99% sure it's free. I mean, it's all of the insurance companies that I've worked with, they all cover it for free because it's such a big deal. You know, they take the time. So gather up all your meds. We call it a brown bag review. So you put all of your over-the-counter medications, your aspirins, your vitamins, all that stuff in the bag. You show up. You've got, usually when I did it with my mom and dad, it was a half hour. And they just go through, and my mom and dad loved it. It's exactly that time where you can ask the dumb questions.
We've heard horror stories where people were not supposed to be taking two things at the same time.
Right.
And that, I'm not saying it was no malicious, but if the doctor doesn't know. And sometimes, we've all heard kind of the God complex type of thing where they're like, no, it's fine. And then you find out later, no, it wasn't. Right. So again, advocate for yourself. Yes. And part of that is going and talking to the pharmacist because that doctor may not have known that A and B should never be taken together, that they counteract or do something. So I highly advise this.
And they will give you hints like this medication can't taken with certain foods.
Empty stomach.
I think, if they say, okay, you need to take this 4 times a day, well, what's that? I mean, is it 2 in the morning, 2 at night? Is it 6 hours apart? Is this 5 hours apart?
Am I fasting over the night or am I waking up to take a damn medication? Yeah, good point.
And just the complexity of like before meals. So I would work a lot of times they'd say, well, I took it before my meal. Okay. And then they eat breakfast 5 minutes later. That's not the point. Like you have to be... on an empty stomach for how long for that to absorb?
So well, I thought it was like you take a pill and then you eat something after, and then the pill went down first, and it was like, no.
So there's just a lot of complexity.
You learn something every day.
So before meals, you usually have to have an empty stomach for a certain amount of time. So
I never knew that.
Or with meals, So
okay, well, that's really good to know. I love that.
And then the other thing, just managing pills, is my dad is Parkinson's and he has to take 2.5. Okay. The dexterity of him trying to split this pill.
Oh, God.
And it's like, sometimes I'm doing good, sometimes I'm doing bad. I'm like, well, look at this half. Like this one's really 3/4 and this one's 1/4. Do you have pill splitters?
Yes, we finally had to get one for my dad too. And that was just, bless his heart, when he handled all his pills, he'd get out his jackknife and he'd, punk.
And then it goes, pew, it's like
every
flying
time
across the room.
Every time.
Like,
and I don't know why we didn't get a pill cutter before that.
They're $5, but it is. Yeah. And I had to push back on talking about providers. So my mom started a medication and they said, okay, it was so complex. It was take a half for 1 week, then one pill 1 week, and then 1.5, so it was a tapered, whatever. And so we get this pill, and it is the size. I mean, I said, I can't split this in half, even with the pill cutter. It was so small. Like, what is happening?
The blade is bigger than the pill.
Yeah. So it just,
yeah.
It was so so they got an earful, but it's just so frustrating in just splitting those pills.
So the other thing you talked about with the how to take the medication was like some things can't be crushed or some things can't be.
Yep.
So talk more about that.
So if your mom and dad are living with like swallowing issues, a lot of times the solution is, okay, well, we're going to crush this up. We've got this pill crusher and we're going to put it in yogurt or applesauce, whatever. Well, some of these medications are extended release, which means they're chemically engineered to be in the stomach and then like release really slow. So if you say, okay, well, just chew it up or we're going to crush this, then you got rid of that engineering feature. Thank you. And all of a sudden it's like, okay, we have the whole dose right now. And you can't do that.
God.
So you can't.
Know that. That's amazing.
So there's definitely some things like if you are in that stage where you need to crush medicine, make sure.
Talk to a provider.
Even splitting them can really disrupt that whole process.
So there might be a better way as opposed to doing a time release. They may need you to take 3 in a day as opposed to, okay, so that is really, and something we talked about this is, and I think it goes along with the next thing we're talking about, is that changes as you age because you might not have had the swallowing issue before, and now you do. So there is a revisiting old medications because what has changed in you, that can be something tangible, like you can't swallow as well, or, and you talked about this and I never really thought about it, is as you age, your metabolism changes. So,
or just even the function. So most of medications are processed by either your kidney or liver. And if those aren't working well, or if things are changing, that can really impact how things are working in your system. So you have to really think about, gosh, I've been on this med and now it's different. Make sure you talk to your doctor about that. Or sometimes what will happen if people have had a certain dye for certain x-rays, it puts them in some kidney failure short term, and then their meds aren't processing right. So it can be really complex. The main message there is just make sure that you speak up if you feel like something's different.
So important. Or even and the problem is you might not even notice that something's different and you might not attribute it to your medications. So I think that, it's funny. I said, well, if you've been taking things for a long time, you're fine. No, you're not. That might actually be more important if you've been doing it for 16 years to actually go and find out, because the biggest thing I've learned with my dad is things happen so gradually that you're not recognizing them or attributing it to anything, just, well, it's the way it is. And then later on, you might, if you find out, oh yeah, his kidney's not processing that, and you're like, oh, I thought, okay. And so even more so with long-term medications, maybe you go in and you talk to that pharmacist to find out, because they might bring up things that all of a sudden they're like, well, do you have any vision blurry or whatever? And you're like, yeah, but I just thought it was.
Another real common side effect of high blood pressure medications is just a it's just a dry cough.
Really?
And people will just live with that. They don't say anything. And it is a very common side effect of almost everybody's on this medication. So if you're just noticing, it's like, I'm just coughing all the time. And it's not it's just a dry cough. It's just really important to keep tabs of those things. And most diseases are progressive. So you are going to need more or higher doses. It's not a bad thing.
Yeah.
You just, the disease is progressing and you need to take more, and that's okay.
Got it.
The other thing I think, now this is kind of funny, but almost everybody has pets. And I've had 2 incidences where I've worked with patients where they took their pet medication or their pet took their medication. So make sure you put those in different spots.
Okay, that is hilarious.
Yeah, I know.
It feels like I do think that the vet medication should not be in the same brown
and I
bottled
noticed
pill
our
bottle.
pet, so maybe they've changed this, but I've noticed that ours it's green. Our medications from the vet are green, but still, you're whipping through stuff.
that is a lot of excellent information about the confusing aspects and some solutions. But the next part we were going to talk about is, and I love the things that you told me about, and I think it's exciting to know, is all the different ways of helping with managing medication taking. Because as we've said, as you get older, things can get more confusing. Plus, you have more. Plus, there's no regularity to almost anything you take. So let's talk a little bit about how we manage, whether we are with our parents, like I am, and so I'm a little bit more hands-on, versus if you are from a distance trying to make sure that your parents are doing what they need to be doing. You did mention before writing in black Sharpie. I think we should all just get like 10 black Sharpies, writing the medication or something about it right there on the top. Like you said, 9 a.m. So we know that this is our morning med. Or we often would put AM, PM on our bottles so that we knew that this is the AM.
Good idea. Yeah.
So that's a really good thing. But what happens when, and I think this is more your situation than ours because I'm with my dad, if it's 4 times a day, and we do know that's what comes in with an antibiotic, which might not be their regular medication, but now we have something new to bring in, but it's only for 10 days.
It's a new habit.
It's a new habit that is not forever. So what are good ways for, what do you suggest when they have that 4 times a day type of?
So some of the things that you can buy is a pill box. And that's the kind of the plastic. So you can put those out. But if most people have a phone with a alarm on that.
Right.
So I suggest, and we did this with our mom and dad, is we put an alarm on the phone. And it's just a real quick reminder. It's like, oh, yep, we got to take our meds. So that's probably the simplest is to have them just put some sort of alarm. Now, they, from time to time, have snoozed that and then forgotten. So there, even the best strategy, there's always a loophole, and you just have to try to, and so sometimes I would call and say, hey, did you take your medicines?
When I took care of my mom after her knee operation, when she had her knee replacement, that was a combination. And I don't know how, I barely kept alive on that thing. And I don't know how somebody would do it on their own. But because she was taking, the heavy duty stuff, plus the ibuprofen, plus Tylenol. And so there was Tylenol, you could only take X amount of milligrams every 6 hours, and then ibuprofen was X amount every 4 hours, and then the other heavy duty stuff was every 6 hours, and you wanted to intersperse it so she was never without some sort of pain medication. And some of it was every I don't know, at the beginning, like every 3 hours or something. And I was sleeping, and would set my alarm every 2 hours. I'd have to get up. But on top of it all, she might say, I don't think I need that one this time. And you're like, okay. I almost wanted to be like, well, that screws up my whole system now.
Exactly.
Like, I have everything.
You are taking these payments, whether you need them or not. Well, and it can be.
I had a chart on the refrigerator.
Yes, and I was
it'd be 2 in the morning, and I'd be like, okay, so 2 of these at this time.
You have to. And
I absolutely had to.
You have to, especially if they're out of surgery, they're on pain medicines. Vicodin actually has Tylenol in it. So you can really...
That's the other thing. Overdose on one of them because it's in there.
And you think, well, I'm just going to take a bunch of Tylenol because this isn't working, or I'm going to take a bunch of ibuprofen, which is a blood thinner, and you just had surgery. So you can't just say, well, this is the prescription, and I'm really going to load up on this other stuff, because it can be seriously...
I found it wasn't just a timing issue. It was math. I had to freaking do math. Because like you said, I forgot about that. One of the Vicodin had it. So I was like, okay, so I just gave her a 600 milligram of this, and then that also has a 3, and I can only have, that was the other thing, you could only have, I'm just going to make up a number, 2,400 milligrams a day. So I'd be going down, okay, so we got 800, okay, so then that means if 4 hours she's going to get that one, then she can get the ibuprofen before it, and then she get... Honest to God, and my mom's very smart and she's very with it, but she was in a lot of pain, and I would just hand it to her. God forbid if I wasn't doing it right. She was just taking whatever I gave her. And then she might say, it's hurting really bad. So then I would have to kind of look and be like, well, if we did more right here. And I'm okay with math, but that was insane between the math and the timing. Those 3-4 weeks... And then weaning off was a lot easier because you're like, okay, we're not going to get to 2,400.
Well, and I think,
good Lord, that
when
was
I was
complex.
helping my husband with this, I thought, I will remember.
No.
You don't remember. I'm like, I'm a nurse. I will remember this. Well, maybe on the first day, but on the 5th day, when I am exhausted, you've been getting up, you do not, and then you do it at 3 a.m, whatever, you don't remember. So you have to write it down. Even if you think there's no way I will forget this, you will forget it.
You will absolutely, because it all blends together. Pretty soon it was like,
together.
Was that 6 a.m. this 6 a.m. or was that 6 a.m. yesterday?
I mean, it's craziness.
Remember.
I know.
Yeah.
You really, really need to write the medications down in pencil because when, you talk about being your own advocate. Well, part of that is communicating with your provider. So you may be seeing multiple specialists and you think that they would know, but they don't.
Nope.
So if you're getting prescriptions from multiple providers, it is your job to make sure that you tell the provider what the medicines are, at least on a piece of paper. I love it when patients bring in all their medicines, and I know that can be laborious, but it is really helpful for them to see the actual pill bottles.
Yep.
So it's just really important to just communicate so they can be successful and prescribe well, especially when you go into the hospital or into the emergency room. They have no clue.
No clue.
And they have to know.
Yeah, they do want the bottles in those situations.
Yeah.
If you do write it down on your piece of paper too, understand it's not just the name of the pill and the amount of times you take it. Write down not just the quantity, but the milligrams. Mm-hmm. Because a lot of times I'm like, well, we take it 2 times a day. And they're like, okay, well, how many milligrams is that? I'm like, I don't know. It's a little pill and then it's another little pill. Like, I don't know what they are. And so that doesn't help them at all because if, so you definitely need to write down the milligrams of that medication. And then the other thing we noticed was that certain things, like you might take, my dad was taking, I'm just going to say calcium, and it also had some vitamin D in it. And I don't really think about that, but they're like, how much vitamin D? I'm like, he takes 2 of those. And how much are they? And they say it. And then they're like, is there anything else have vitamin D in it? I'm like, oh my God, the magnesium had vitamin D in it. So now we've got D and D and D. Again, math.
I know.
Again.
Yeah, they sneak that in because
they
it's
sneak
really
that
good.
in.
Yeah.
Mm-hmm.
So did he have vitamin D milk?
Fortified cereal. Yes. So know that the milligrams is actually more important than the number of pills.
Yes.
Definitely write down your milligrams.
So then there's the pill box, we'll say. So this is the plastic thing with the Monday, Tuesday, Wednesday, Thursday.
AM, PM.
Yep. And so you can get all different varieties of those. So you can have 1 strip if luckily, if you parents can brag, they only take 1 pill a day, then you've got that. Or you can take it where it's across, where it's Monday, Tuesday, Wednesday, Thursday, Friday, and then AM, PMs, whatever. So
do they have multiple ones for that? Because my dad just has the AM, PM, but I know that your father-in-law takes a ton of medication a day. Do they have ones that are like AM, AM, PM, PM?
No, it's more like AM, mid, and then noon. I can't remember, but there was 4 slots on how that was done.
Okay.
So we're way past that, so I can't really remember.
He's like 6 a day, so no way.
Does. Yeah, so there's the shadow side of that is there's a couple of limitations with that. Number 1, if you're taking big pills, the little box with the thing is only so big.
Yep.
And then what got confusing was he would grab the wrong pill box because there was multiple pill boxes.
Wow.
So and sometimes if they're not, getting them out can be a dexterity problem. And so then if all the things aren't sealed and they dump it over, then they could all come out. And I have a funny story about that. So my mom came home from the hospital and she had the 4x4, or 7x4. So 28 little squares.
Jeez.
We had all of these meds, some of them are new, blah, blah, blah. And I had that thing just all done. So the very last plastic square I pushed down and the thing went flying through the air and smashed on the tile floor and popped open and the pills went all over the place. So was like, oh my gosh. So then we had to like sweep up the pills. Well, I don't know. So what are these yellow ones? So then we had to reverse like, okay, this matches this bottle. It was and I was tired. I just wanted to go home. So I guess be careful that you don't do what I did.
Yeah.
But yeah, so there's the medication boxes.
Well, so what's funny is you talked about something that I think is really cool, and that helps with what you just said. So if you do have the big boo-boo, you talked about something I'd never heard of before that I don't know if you invented it or if it's out there, but the pill mat or like a placemat.
Placemat.
Okay.
Yeah.
So how does that work?
Okay, so what you can do, and this gets a little more complex. This is a craft project.
Okay, so for you crafty folks out there.
Yeah, so what I did for my dad is find a picture of the pill on the internet, download it on Google, and just print it off. So there's two ways you can do it. First, we had just a list of meds with the picture, and that worked out pretty good. But that evolved, so then we moved to the placemat. Okay. So we had a placemat for every time he took his medicines. He would take his morning placemat, and then he would match it up and say, okay, so these are my pills, and I'm going to take this pill and put it on this picture. And yep, I've got all my meds. Swoop them up and take them.
Do you know, we're going to have to do a YouTube on this so that you can actually show, because it's really it's a great idea for someone who's in your father-in-law's situation. And again, for a certain stage.
Right, exactly. So there's and that's one of the things
exactly
for each stage. And I'm going to say this again. There's no perfect.
No.
There's always time for error, and you still have to, unless you have someone that you're paying, which nobody can afford, but they're going to make errors too.
Yep, I did
so
too.
Then the next thing that we had to move to, if you're working or, supporting someone that's living with Parkinson's, a lot of times they have to take meds 6 times a day. We were doing different strategies around that. And then what we moved to is like we were making our own medication bags. So we had these little plastic bags, and I got like a sealer. Okay, so it was like almost like a freezer sealer.
Yeah. No, I know.
Okay, so it was like that. So you held it down, and then it would seal it. Okay, and then I would take my black Sharpie and I wrote on there, this is the 9 a.m. bag. This is the 11 a.m. bag. This is the 1 p.m. bag, the 4 p.m. bag, the 7 p.m. bag, and the 10 p.m. bag. And then I got a little plastic container and put all the bags in that. So then we labeled the plastic containers Monday, Tuesday, Wednesday, Thursday, Friday, and we would go and drop those off every week, and he would just take that, and then he would go through his bags.
My God.
So the problem with the bags was that is what I did for 4 hours every Saturday. You can't, like if you got towards the end of the roll, it was really hard to open them for me. And then sometimes he had a hard time, like a lot of times he just went to the scissors and opened them. But what I did like about those is he could pick the bag up and travel.
Nice.
Because he went to the store and he had taken it one, he had his, and he actually had one of his medications. He has to take this medication for his Parkinson's at 1. We got him a little pill bottle for his keychain. So if he was out and about, he had a little stash in his pill. So his alarm went off. It's like, oh crap, I'm not home. He had a little backup stash with him in his keys. Again, you have to make sure he can't be in a hot car. And it was just a dry pill, so it wasn't a big, but
so that takes a lot of wherewithal to get it done. So it's almost like I always say that this is a long-term, no, what's the way of saying it? It's like it was a pain in the butt to do.
Yes, it was. And I got angry about it.
Okay.
Yeah. And so that was not good.
But in the other side, then you don't have to deal with it for the next week.
Exactly.
And I noticed that with a lot of things we're dealing with is like, in the short term, this is a pain in the butt, but it helps me in the long term. That's the phrase I'm looking for. And he was taking them consistently. But you have to be willing to give up the 4 hours every Saturday in order to make that happen. Is that worth it when you didn't have to deal with them for the whole week? Maybe, maybe not. Or maybe it is something that they can do at a certain stage for themselves, but at some stage they no longer can. Like you live near them. I live with them. But if you are from afar, what do you do? And so you had another thing that you guys worked with that I thought was cool. Was it the timely meds?
Yeah. Yep. So then we were working with the home care nurse, and I was complaining about the time it took, and I made errors on that. Yeah. Anyway, so we'll move on from that. She said, "Yeah, Timely Meds is a company. So there's Spartan Nash is a grocery store chain. Okay, and of course they have a pharmacy, and they have a service for free. It's called Timely Meds.
Wow.
And so what we did to utilize that is we had all the prescriptions transferred to a Spartan Nash grocery store. Then I called and talked to this Timely Meds person, and this was actually pretty cool. My dad could not use it because the max they could do was 4 times a day. Okay, so that we'll talk about what we had to do for that. But my mom could. So again, we'll get a visualization of this, but if you can almost remember at Christmas time when you would get the Lifesaver books?
Yes.
Okay, it was like that per week. So week 1, you opened it up and they had these bubbles. So it was the Monday, Tuesday, Wednesday, Thursday, and then they had the meds, and they made their own little bubbles with the pill packet in there.
Wow.
And they had a picture of the medicine. They had the name, the generic. I mean, it was slick. It was really, really good. And so she would just take her book. We had an alarm on her phone, and she was there. Okay, until they changed her meds. So you would get a month at a time. Okay, and this is the same thing with the bag solution.
Yep.
And I don't know how to,
So it's great for when somebody has something stable and consistency. And so there is a time for that.
Yes.
And there's a time for Timely Meds in it.
There you go.
I love that. So there is a time for that. And that is an amazing service. I've never even heard of it.
I was very pleased with them. Yeah.
That's awesome. But then there's a time where it no longer works.
Right.
Because things change. And as we know, when things progress, the changes become more frequent. So as opposed to, I did that for 3 years while I was taking these certain meds. As we come to the later stages, things change in a more rapid pace. But even for ourselves, I'll just say briefly, one of the things my mom tried to do with my dad was to make sure, because he always handled his own medications. She wanted him to use his noggin. And once he got bedridden, he couldn't do it with his hands, but we would stand and go, how many of these? And is this morning or night? He'd go 1 for AM, and then we'd put it in a little thing. What about this one? And we went through all of his meds that way, and it was a way to keep him cognitively engaged in using his brain. More recently, we've decided, like you said, that's a lot of time every morning to do all that, and we have started using the strips and just handing it to him. There's a time and a place. And for a long time, it was important for him to use his brain in that way. And right now, it is important for us to have some time to ourselves and not always be engaged in that. What is your most recent one?
So we have an automated machine that helps distribute the medications. Wow. So again, there's automated machines to do this that are much more simple, that maybe distribute 3 meds per day. They're not very expensive, and it has an alarm. So again, you can go through kind of the Pinto model, which works. Okay. Well, we've got the Cadillac. All right. So this was quite.
You have 2 people who are dealing with multiple issues.
Yes. So one of my parents is on 16 medications and taking them 6 or 7 times a day, depending on. Wow. I mean, I can't. No. I mean, this is crazy. So they each have their own machine. It's called MediCube, MEDI Cube. I have been extremely happy with this product. I mean, it's so nice. I mean, just so helpful. You do have to have some computer skills, and you do have to have Wi-Fi set up to use the whole functionality. But basically what it does is there's bins, okay? And you set up the medication. So it will say, hey, this is the med. What's the dose? Set up the times. And then it will dispense 8 a.m., it says time to take your medications really loud. And then it dumps into this thing. It pops out and it will tell me on my phone if there was a problem with the machine. I can look at what was dispensed, and we've had to use that a couple times because they're like, this isn't right. And it's like, no, it's right. I can see it. It is right. They tell us when the medication level is getting low, and it can also tell us if they skipped a medication. So we will get an error or an alert on our phone and say, this medication is still in the bin and your parents did not take it.
Wow.
So it's very, very nice for people. And then the other thing that we use quite a bit is we can actually change the medications from our phone. So if they say, well, we're going to increase this med. So sometimes that doesn't work if it's a whole different dose. Obviously, you have to go in and change the pill. But sometimes it's like, hey, we're going to bump this up today.
Yep. My dad will want 3 gabapentin as opposed to 2 that time. Yeah.
So then we can just from our phone say, okay, now we're going to increase this to 3 times a day. And now these are the new times. And you're updating, so you don't have to physically go. So that has been the best solution for us. It was over $1,000, so it was an extreme investment. We did buy one refurbished, but again, your time is worth something too.
Yep.
And so we really needed to just invest into this machine. Because of the time. I mean, 4 hours every Saturday, and now we've had this machine for 2 years, so.
Wow.
And it's just been a really, really good strategy for more sophisticated, complex regimens, and then you also layer on the forgetfulness.
Yeah.
So that has been a solution that's been very helpful for us. So lots to think about.
Wow.
Lots of solutions.
I think somebody could listen to this one a couple of times.
Yeah.
Did you take notes? Did you take notes, people?
Yeah.
No. Thank you so much. Honestly, it's really the combination, like I said, between your expertise as a nurse, but also your expertise as a person who is really dealing with this. Mm-hmm. And I think that is invaluable. So much information you gave.
It's the how do you manage this medication mayhem?
Exactly. And it changes as time changes. And there are different options and things that you can use as you find what works best for you under these circumstances in this situation with these people. So it will change, but you have, I think we have everything from they're good to holy crap, they're not. So and everything in between.
Yeah.
So I hope everybody learned a lot. I know I did. And we'll look forward to next week with the next new topic. But thank you so much for making the mayhem just a little bit clearer and cleaner.
Thanks for listening.
Yep. Thank you so much for joining us today. If you liked what you heard, be sure to hit subscribe. And if this podcast has helped you in any way, please be sure to share it with your friends and family. There's a lot of us out there stuck in the middle of this caregiving journey, and it's always good to know that we are not alone. Thanks again for listening. Until next time.
2 old friends talking 2 old friends.